Get a whole grip on them. Does your family have a plan in case of a fire or emergency at your home? It's Fire Prevention Week. Bruce Garner is here to join us with some safety information and a fundraiser sponsored by Warehouse Row and Tupelo Honey Cafe. But first, advanced imaging technology at Erlanger Medical Center. One of the biggest health problems in our community, according to Dr. Chris LeSar, is that there is a high incidence of vascular disease. Now, that's a disease involving the arteries of the aorta, I'll get it right in a minute, the carotid arteries in the lower extremities, all very dangerous conditions. So we went to talk with Dr. LeSar about Erlanger's new endovascular surgery suite and their Dare to Care program.
These blockages that can form can cause strokes, high blood pressure, lead to an aneurysm that can dilate like a balloon and rupture, and can lead to someone's premature death.
These things are preventable?
If we can find the carotid blockage before it causes the stroke to the brain, then we can prevent a stroke from happening. If we can find the aneurysm that's inside the abdomen and catch it before it ruptures, then we can prevent death from that aneurysm. We try to find the problem so that we can fix the problem. Many people do not realize they have the problem until they've had the stroke or until they've had the aneurysm rupture. But that's too late. We have to find it ahead of time. The only way you're going to find it is by identifying people with the right risk factors, get the proper ultrasound test to understand what it is, and then plan the therapy to fix the problem. Dare to Care is a free screening program for our community where we look for these problems. For people that have high risk factors for these problems, someone that has diabetes or high blood pressure, someone that has an aneurysm in their family, these are people that should come to this screening and learn about the problem. We plan to educate people about the problem and then also do the testing to figure out if they have that problem. I need to find the people that have not taken care of their blood pressure, that are not taking their medications, who are smokers, who know that they shouldn't, but they have. And I need to find those people to help them learn about their problem and then potentially what we can do to fix the problems.
I understand this is the second such unit in existence in the U.S.
Yeah, this is a very special operating room. It's at Erlanger Hospital, and it's specifically designed to do major open surgery. That's the traditional operations. It's also designed with the latest imaging to do all of the endovascular surgery. That's the minimally invasive. We do things now through a small needle that we would have to do major surgery for in the past, and people can go home the same day. It's quite remarkable. We have the capability to fix many of these very dangerous problems in simple ways, in safe ways. People seem to enjoy their care here.
We looked at the old facility. Compare the two of them.
The imaging is an older unit. It's about 10 years old. We have been doing this type of surgery for 10 years in this town. But as things get more advanced, the imaging requirements are higher. We need to see better and have more mobility of the unit in the room. This unit behind me will drive around the room and get to the right position that we need it to for the patient. It allows the anesthesia team to be here or other orthopedic teams to be here if there's complex problems. It's a much more useful machine to help our patients.
We're trying to educate the community and also provide free screenings for the population at large so that we can decrease the risk of life-threatening strokes, heart attacks, cardiac and vascular disease. We have found 6 critical carotid blockages that required surgery. We've had 2 patients that needed coronary artery bypass grafting, and we've had several with high blood pressure that was undiagnosed, high cholesterol, and blockages in the legs. Our screening will be this Saturday from 9 to 12 at Erlanger East. You will need to register for the program, 778-LINK. We do have limited seating because we do provide education. We have surgeons who will be speaking on various topics, but limited ability to actually be able to do the screenings. And the screenings really are almost head to toe. We do blood pressures, we check cholesterol, we check blood sugar, we check the pressures in the legs. We do a carotid ultrasound, an abdominal ultrasound, and then answer any questions. You can speak with our physicians. You have time to listen to the lectures. So it's really a full 3-hour screening and education program.
Once again, a reminder, free vascular screening is Saturday, October 12th, 9 a.m. to noon at Erlanger East Campus on Gun Barrel Road. And you must pre-register. So give them a call today at 423-778-LINK. And for more